Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is today talking about the how to select a research topic or research methodology in which important topics or problems or any kind of gaps in medical system, medical treatment, drug development, as well as vaccines, community behaviors, and new problems just like narcotics and high screen use among adults, mental health, mother and child health, and even nutrition and environmental health. And now climate and health is also important. So, Dr. Hussain Bashkolachi YouTube channel is just focusing on the MBBS curriculum by Pakistan Medical and Dental Council, and same is true for the Indian Medical Council and other uh, MBBS curricula in different countries. This is also a postgraduate level activity, but now the research is a very fashionable and very important word. And after the AI tools are available in the hands of the people, young people, students, universities, academia, researchers. So every day this research topic is expanding, and there is a kind of a race between the practice, research, and academic information or the old information. So, but today I thought that I must share. This is the second video, and you will learn many steps how to select a research topic, particularly in community medicine or public health. In some countries, it is called community health, and in India, it is called preventive and social medicine. So, but it is largely a kind of preventive side of the healthcare delivery system. So care providers, they must understand that the area in which the community is facing more problem needs new understanding, insight, and to apply research method, collecting the data, types of the data, and then developing hypothesis and generating sample and ultimately giving the results and guidelines to the policymaker, to the community. Now, research is now not in academia, but it is. So there was a kind of electricity problem. So if there is some disturbance in the YouTube or in the video, please just don't be disturbed. So again, I am sharing the PowerPoint, and then we can understand better that how this topic can be understood. So let I should give you a first slide in which choose your research topic in community medicine, a comprehensive guide. And I have used a kind of app to prepare this, but I have no interest or I have no conflict of interest. So this is first slide and showing that community medicine research topic, how to choose a comprehensive guide. Then the second slide uh, shows that why your research topic matters, impact, and relationship. The targeted intervention, a well-chosen topic, addresses pressing health issue. Pressing health issue means this is a urgent in the eyes of the researchers and in the eyes of the community they are suffering, leading to effective community level intervention or prevention or solution. Second, data driven policy. It is also important if you have a policy or decision making or any kind of method, and if it is data driven or it is well researched, relevant research provide crucial evidence to for informed policy making and resource allocation. Even resource, suppose somewhere the diarrheal diseases are more, so you can focus on the provision of clean water, sanitation, hand washing, and ORS making and use of the ORS. Community empowerment, engaging with local needs ensures research benefits and empowers the community it serves. So community can also feel that they are able to solve, and there is one TED talk that community is medicine. So don't think that the human beings are not able to cure themselves or throw away or prevent the health problems which are killing them or maiming them or paralyzing them or disturbing their daily life. So then is the third slide. You can see that for the selection, you have to brainstorm or you have to think the broader area, identifying community health needs. So you have to do a focus group discussion, community meetings, as well as seminars, consult books, literature, as well as the old record, and even consider global health challenges with local implications. Suppose climate change is there, accidents are there, increasing, suicides are increasing, our mental health are increasing, and even the poor people, the malnutrition, overnutrition in the rich class, fast food, and noise pollution, as well as disaster. So there are hundreds and thousands topics, but you have to discuss the broader area with the community. Then you can see that narrow down these from general ideas to specific question. And these are three specific questions. First, identify a population, define the specific group your research will focus on. You can't research in the entire world or in the entire country in short time and with no resources or low resources or less resources. Pinpoint health issue, that is important. You have to precise, you have to narrow down, you have to articulate the health issue or health problem, disease. I was just taking a class of my student in Isra University. Then I asked a student that in last clinical posting or hospital posting, how many diseases you have observed during your clinical posting. They were the fourth year students, so from third year, almost a year, they were going to the patients to the hospital side. So the list showed that some wrote four diseases, some wrote seven diseases, some wrote 10 diseases. So average was about eight diseases in a year a student is visiting or observing in the clinical setting. But this number in the hospital, because it is a 800 bedded hospital, so out of 800 patients, if in a year a student is seeing only eight patients, then we have to think to expose them in more ward postings, and even at the evening time they can help the paramedics, doctors, and history taking and learning of the student can improve, and number of exposure to the patient can also improve. That will improve their understanding of the patient care and applied medical practice. Then formulate a question. This is you know that every problem is a question, every problem is a statement. Transform your focus into a clear, answerable research question. Then, coming to the important aspect, exploring the literature. But before that, I will mention that the finer word is used in the research world, FINER. F means feasible, N means novel or new, and I means interesting, and E means ethical, and R means repeatable. So the literature review are what is known about the past are published in the past are present in the journals, documents, reports, books. So the foundation of the knowledge conduct a thorough literature review to understand existing research, identify gaps, and prevent duplication. Use academic database, PubMed, Scopus, Web of Science, and now artificial intelligence. And particularly, there are certain apps available, and one of it is consensus or concise. You can explore, but there are many apps. Read systematic review and meta-analysis. Meta-analysis means the many studies are analyzed, and ultimately the more studies showing there is good result and effective solutions can be narrowed down, and we can filter it, and there is a specific name to such a uh, process also. Identify key theories and methodologies. Methodologies are important, and methodology includes observational methodology and experimental methodologies. Note areas requiring further investigation. That is more important. Then coming to the considering feasibility, resource, time, and ethics, I have already mentioned. Finer word is, I think, appropriate, easy to remember, feasible, novel, ethical, as well as repeatable, and we can say that it can be time bound also. Then coming to the last part of the presentation, yes, considering feasibility, I have already mentioned, and then coming to the engaging with the community, identifying local priorities. Once again, you will see the community leaders, consult the local leaders, focus group discussion. We call it FGD, organize focus group to gather qualitative insight from the 6, 7 people. You can see in the picture, it is a small group discussing, and community leaders are also there, health professionals, surveys, distribute surveys to capture broader community perception and needs. Survey is larger than the focus group, and it is also done uh, on the paper or questionnaire, and survey is one of the research method also. Then coming to the objectives or question, the SMART principle I have already mentioned, the finer, feasible, novel, uh, ethical, as well as repeatable. So, and interesting. FIN means interesting. The topic should be interesting, or it should look that this problem is there. So, SMART is specific, measurable, achievable, relevant, and time bound. This is important, and you can have this question that what is SMART, and also we can have other tools also. Then coming to the getting feedback, mentors, peers, and stakeholders. Mentors, peers means your colleagues. Mentor means who are experienced, and stakeholders who will use this or benefit from this or who will buy your research. So this can be important area, and the finalizing your topic, confidence in your direction. That is important. Your direction should be correct. If your research direction is not good, your research direction is not showing the correct, precise reaching point or end point what you want to achieve out of this research. So the direction is important with careful consideration of community needs, existing literature, feasibility, expert feedback. You can confidently finalize research topic that promises significant impact in community medicine. Ready to make a difference? Your journey into impactful community health research begins now. So, with this, I think we are ending this uh, uh, presentation, and hopefully, you will understand that how this presentation can help you and the colleagues uh, which are interested, and particularly the MBBS students. I will suggest that they should listen this again, and they should also understand that how research is simple, but it requires a complete understanding. It requires knowledge of the data, knowledge of the epidemiology, as well as the community or the sociology, so that you can adopt this kind of research program successfully. And with this, I think we are ending our